Hello and welcome to Addressing the COVID-19 Crisis, an open forum webinar series for the profession of pharmacy. I'm Michael Hogue, Dean of Loma Linda University School of Pharmacy and President of the American Pharmacists Association. I'll be your host and moderator for today's program. Today's program is being co-sponsored by the American Association of Colleges of Pharmacy, and we will be discussing the successes and the barriers to student pharmacist involvement in COVID-19 vaccination. As you all know, we are trying to pull off the biggest COVID-19 or the biggest immunization activity that we've ever done in our nation's history. And we need all hands on deck, including student pharmacists and our schools and our partnerships with community and mass immunization clinics are important. I would also note that today has been designated as COVID-19 Emphasis Day by the Biden administration. So it's serendipitous perhaps that today is Pharmacy's national broadcast webinar discussing COVID-19. And so it's an exciting time for all of us. We have three great speakers with us today. First, joining us from the American Association of Colleges of Pharmacy is Dr. Lynette Bradley Baker, the Senior Vice President of Public Affairs and Engagement for AACP. She'll be sharing a good bit with us about what's going on nationally with schools and colleges of pharmacy. She has worked in a variety of settings, not only in academia, but also as a community-based pharmacist and in a health research firm, and she's had many different leadership roles with the Maryland Pharmacists Association. We're also being joined today by Dr. George McKinnon, the founding dean and professor at the Medical College of Wisconsin School of Pharmacy. He has also professor appointments in the Department of Family Medicine and in community medicine at the Institute of Health and Equity, and serves as an internal advisory member of the Medical College of Wisconsin's Genomic Science and Precision Medicine Center in the area of pharmacogenomics. During his career, he has served in leadership capacities in the establishment and accreditation of 4 new colleges of pharmacy in the United States. And MCW has been very active in the COVID vaccine world, and so he's going to share experiences from their School of Pharmacy. And we're very excited to have with us a student pharmacist. Catherine Albert is a student at the University of South Florida, and she is an active member of her APhA ASP chapter, having served as the OTC Medicine Safety Co-Chair, President-elect, and President of her APhA ASP chapter. She currently serves on the APhA ASP National Standing Committee on Member Engagement. So we're excited to hear directly from a student pharmacist about experiences at her university and across the country with COVID vaccine. This week, like all weeks, we'll also be joined by APHA's internal experts who'll help us in answering questions. Mitch Rotholtz, Chief of Governance and State Affiliates. Mitch is also one of our leads in liaisoning with the federal government agencies, particularly CDC, on vaccine-related issues. We'll also have with us today Dan Slott, Senior Vice President for Education and Business Development for APhA, who will answer any clinical questions you might have. And we will also have Dr. Elisa Bernstein. Elisa is our Senior Vice President of Pharmacy Practice and Government Affairs. And if we have questions related to regulatory issues, Elisa will share those. We do have some news to share with you toward the end of the program today about our ongoing activities, and we're going to share some information with you that I think you won't want to miss in terms of pharmacists and COVID vaccines, some recent data we've collected, and we'll also share with you some details of the Biden administration's vaccination engagement plan for pharmacists, and we'll get some commentary on that. So lots of things we have packed into today's webinar. If you're joining us for the first time, let me just briefly orient you to how this works. There is a questions panel in the GoToWebinar control panel, and if you click on the questions box, you can type in any question that you have about COVID-19. You can comment or offer feedback, or offer your reflections about today's topic or any other topic related to COVID-19 that you feel the audience would benefit from, and get your questions answered. We encourage you to go ahead and enter questions in now. Don't wait on our speakers to start talking. Well, let's get your questions in so that we can be sure that we get to as many of them as possible during our interactive Q&A session. In addition, there's a handouts tab that includes the slides that we're using in today's program. You can download that right here in the GoToWebinar control panel, and all of the links that we provide to you for resources are active and will take you directly to the reference resource that we're using. You should also know that today's webinar is being recorded. It will be posted at pharmacists.com in the coronavirus resources section, and you will be able to access that beginning tomorrow to share with friends who may have not been able to join today's broadcast but are interested in listening to the details that are going to be shared today. So that's also something that you'll want to know as well. Well, thank you very much for listening to all the instructions, but now I want us to jump in just as quickly as we can. Lynette, George, and Catherine, would you please join me, and let's get down to brass tacks here and talk about what's going on in the world of COVID vaccination and how our schools and colleges of pharmacy and students are integrated into the processes that are going on. So Lynette, let me start with you. From a national perspective, can you describe just some of the ways that you're seeing students get involved in the COVID-19 vaccine efforts?
Sure. First of all, I do want to thank you, Michael, and APhA for providing these webinars since March of last year. They've been very informative, and AACP deeply appreciates the invitation from AACP for today's webinar. At AACP, we are collecting and hearing from our various colleges and schools of pharmacy the many ways that faculty and student pharmacists are providing their contributions to the COVID-19 vaccination effort. We're hearing about student pharmacists being involved with vaccination during all phases of what needs to take place in terms of vaccination. So assisting with the flow of patients or people as they're coming in for their vaccines, helping to schedule those vaccine appointments, assisting in the various paperwork and other documentation that needs to occur, as well as providing patient education or answering questions both before and after the vaccination is given, and certainly helping to prepare that vaccine for administration and, of course, administering the vaccine itself. These activities started in mid-December when the first vaccine became available, and schools and colleges of pharmacy are partnering with various entities, including health systems, long-term care facilities, local and state health departments as well. And there's just been a lot of effort being shown by pharmacy academia to provide vaccinations for those in the Group 1 category. We're also seeing that several colleges and schools of pharmacy are authorized COVID-19 vaccination providers as granted by their local and state health authorities. And so I had a call earlier today with a school, and schools are really preparing for the next phases, those mass vaccination efforts, working either by themselves within the confines of their schools and colleges of pharmacy or other health providers, other health profession schools, and certainly utilizing the external partnerships that I've already mentioned.
Well, that's great. It sounds like there's a lot of good things going on. Catherine, as our student panelist today, I'd love to hear what your school's doing. Tell us what's working there in terms of your efforts with COVID vaccine.
Absolutely. So as you had already mentioned, I am an active member of our APhA ASP chapter at USF. Our chapter advisor, Dr. Angela Garcia, is actually the lead pharmacist at the COVID clinic at the USF Health Morsani COVID-19 clinic that they've created. And our side, as being on the pharmacy team, is more of the inventory management for the COVID-19 vaccines. At this time, we are not currently administering vaccines, but this has given us the chance as students to see how vaccine preparation, storage, and you know, making sure that all of these tasks are completed so that proper administration of the vaccines can occur. So I've had the opportunity to work with Dr. Terry Ashmead, who is running the clinic, as well as nurse manager Amy Patterson, to kind of understand the process and the flow, and figure out how to appropriately manage our inventory and ensure we're making the appropriate amount of vaccines as to not be wasteful and to follow the best practices here. So it's been a very educating experience from the back end and kind of being in the front ends of the COVID vaccine clinic.
So Catherine, I'm curious, is the clinic that you're working in an appointment-only clinic, or is it a walk-in clinic, or how is that working?
Yeah, so it's an appointment-only clinic as of right now. So they have been taking more SANI patients, and it was actually very cool. The process of how it all works. So the pharmacy team is upstairs at Morsani. We're preparing all the vaccines and we're bringing them down as the appointments arrive. Dr. Garcia has actually been working with our College of Pharmacy to make her site and her work in the COVID clinic work for IPPE and APPE hours for students, which has been awesome, especially because I don't know about you guys, but in Florida, a lot of our sites have been having to drop students because of COVID and not having the ability to have them on the team. So Dr. Garcia has been able to create efforts and trainings and all these things for first year and final year student pharmacists to get their hours completed and to learn more about vaccine administration, management, preparation, and all these things. So it's been really great.
Yeah, that's great. Now, George, in Wisconsin there, you've been working with public health authorities, you've been working with your health system. Tell us a little bit about your large-scale vaccination effort and what those collaborations have looked like.
Sure, Michael. So we began certainly planning back in mid-fall, ramping up in November, and began immunizations when we became an identified site on December 22nd. To understand where we're located, the Medical College of Wisconsin, the School of Pharmacy is on an entity we call the Milwaukee Regional Medical Campus or Center. And there's other healthcare provider entities there, Frederick and the Medical College of Wisconsin and Children's Hospital. I say that because all three of us are individual entities in terms of providing the COVID vaccine to our 1A healthcare providers. And that's important to know. So we alone have responsibility of over 6,000 employees to immunize at the Medical College of Wisconsin ourselves. So we work certainly at the county and city level, but currently right now in our phase 1A has been our own healthcare providers. It's been a team effort within the School of Pharmacy and our Office of Research. And so when it was identified that we were going to move forward with our own COVID clinic on campus, we had already kind of greased the wheels, so to say. Within the fall, we offered 3 on-site flu clinics that we've offered for several years now, but expanded them this time around to kind of get a footprint for what we knew was forthcoming. So I think that worked well for us. Our students have been incredible. You have to mind you, December 22nd is the typical break, holiday break. They came back and volunteered gung-ho to be there. And certainly they've continued after that time period with us. We should pass over 3,500 immunizations today. So it's been pretty much an all hands on deck approach. Along those lines, you'll see in the slide in front of you where it says we expanded to non-affiliated healthcare providers. That was a result of, we recognized there was healthcare providers, think of them as independent dentists, maybe a physical therapist who has their own practice site, a podiatrist who's not affiliated with a medical complex or center, but still was a 1A healthcare provider. So last week we opened that up simply to what we call a small number, 450 of them. Many responded and came on site. And so we enfolded them as well to our 1As. And so recently, as we know at the state level, it's the states that make the determination of the different tiers, 1A, 1B, 1C, what you might have in your own state. And so just yesterday, they made the determination that expand COVID vaccinations to 65 and older. So we're looking to see what that might mean for us. We're certainly set up for our healthcare providers, but we've already engaged again with the chief medical officers respectively at the city and county to try to be available.
So I want to kind of hit on something George talked about here, and that is that initial vaccine supply in almost every state, not every state, but in a lot of states, went to hospital-based providers. And of course, many of our schools and colleges of pharmacy, such as here at Loma Linda, are connected to a major medical center. So the integration of students into that process made a lot of sense, and it was pretty easy to do. But now as we spread into people over 65, and we're talking about millions and millions of people, hospitals that are surging with COVID patients are probably not the best places necessarily to do mass immunization. So community pharmacists, we know, are right on the cusp. They're begging, please let us in the game. We're ready to start immunizing in community pharmacy. Catherine, I wonder, have you heard stories from other students across the country since you're involved on the national level? Are there schools and colleges of pharmacy where students are actually connecting with independent pharmacies and chain pharmacies to be able to immunize patients in the community?
So actually speaking for some of the students that go to my university and that are in my class with me, a lot of them have been talking about our community pharmacies like Publix, Walgreens, CVS. They all keep saying that, you know, we keep hearing that it's coming, it's almost here, this is going to be who has it first. I have a friend of mine that works in an independent pharmacy in Tampa, Florida, and he's also been hearing it from his pharmacy supervisor. So I don't have any examples head on of like hearing it just yet, but I know that it's coming and it's coming soon because it's getting talked about more and more amongst all the students.
George in Wisconsin, what about you? Are you hearing stories of community-based pharmacies that are either already vaccinating and using students to help with manpower, or is it in, you know, some of the preparatory work happening?
Sure, no, and I guess I'm remiss. I should have also stated that of those 3,500 vaccines, about 95% of those were administered by student pharmacists with the oversight of pharmacists as well.
That's awesome.
So they're getting a lot of experience, and myself included as an immunizer within the clinic overseeing students. And so sites know our students have that skill set and hunger. We have had a number of community pharmacies, our community partners, that have received small allotments, and by that I mean maybe 5 vials, maybe 10 vials. And they have made a call out, at least this last week, to 1A healthcare providers. So where our students are involved in rotations, either on their APhAs or APhAs, tomorrow is a big day for us because we send our students out every Friday on APhAs for 2 years. And so they know they're available on Fridays, and it mirrored actually what happened early on in the pandemic. Was our students who were trained in nasopharyngeal testing were called upon as well, because they could actually do that sampling, which we now has since changed. So certainly the students have been recognized as being a high quality resource here in the state of Wisconsin.
And Lynette, maybe you have some other examples of schools and colleges that are really getting engaged in community-based immunization.
Sure, and I think the schools are really being approached for student volunteers, student pharmacists, either through their experiential education, through their APhAs and their APhAs, certainly through volunteer groups. We're hearing of groups such on campuses such as APhA, ASP, that are organizing themselves to be able to go out with the oversight of a pharmacist or a licensed preceptor to be able to assist community-based practices that either now have the vaccine or will have it in the future. And certainly there's, I don't have a number on this, but there's certainly a lot of our student pharmacists that are employed, as Catherine said, by various entities, including community-based practices. And so they know that it's coming soon and that they will be involved, whether it's at their site directly or working with other community-based organizations such as churches and healthcare centers and the like, to really meet the needs of patients once it gets to that point of availability.
Well, I know here at Loma Linda, we're launching next week a mass immunization clinic at our Drayson Center in Loma Linda in San Bernardino County. And we have capacity to immunize 2,000 people a day through this mass immunization center with lots of interprofessional interaction and so forth. And I know my friends down the street here at University of Southern California have been doing the same thing at Dodger Stadium in LA. with mass immunizations. One of the things you said, Lynette, reminded me of a bit of a challenge we're having right now as we look at all of the different healthcare professional students that are getting involved with immunization services. It's challenging in these large mega clinics to make sure you have appropriate supervision. So pharmacy students have to be observed by pharmacists in a lot of states. That's the rules. And nursing students have to be observed by nurses, and medical students have to be observed by physicians. George, you've encountered this challenge, and could you comment just a little bit about the supervision of students during mass immunization events, and what's the current state, and what are you hopeful might happen in the future?
So I think there's a couple things that guide us as we move forward to engage in interprofessional practice, of which this is. Certainly it falls under the guidance of education. Is we have our accreditation standards that we have with respect to our programs, LCME for medicine, ACPE for pharmacy as examples. And I know the LCME standards are very open in terms of that the scope of practice the individual, the student may be overseen by as long as it's appropriate for the scope of practice of their healthcare provider. So it's fairly liberated in that regard. ACP, we don't have that necessarily stated, but we also have our pharmacy examination standards that we have with respect to boards of pharmacy. And that has been prohibitive, at least in the state of Wisconsin, that we actually state the year in which a student must complete their education as somehow that bestows the ability to be an immunizer, as opposed to the technical skill set offered through a training program like APhA has, or other states have their own. And so we've been navigating this because on the medical school side, we don't have as robust of probably of a training and educational program as it relates to immunizations, but there's a significant amount of individuals in the medical school we think would love to be more involved. And so again, on the state level, where the challenge comes, you mentioned, we've got stadiums here. Green Bay Packers are playing this weekend. I'm not sure you'd want to go get an immunization out in the cold, but we certainly don't have cold storage issues then. But that said, and so with that would be the issue of oversight. And so we certainly want to make sure that the immunizer has appropriate oversight and that they have been trained in that regard. And so we're trying to do that. We're trying to figure out ways. We may be very innovative in that approach to make sure the medical students who want to be involved can be involved, as well as nursing students. So in these mass immunization clinics, we need an all hands on deck approach. And I think this is the time we really need to work with our legislators, our respective professional licensing bodies, and our accreditors to be liberating and not prescriptive. And so I think this is what we really need to call upon them. And again, this might be the forum through APhA to help give us guidance among the other programs out there in schools as well.
I'm struck by the fact that we really want all healthcare professionals practicing at the top of their training and not have all these restrictions that create barriers to being able to get people immunized. Now, one of our audience members today has made a comment that chain pharmacies are telling, at least in this area, the students that they have to be employed as an intern by the chain in order to be able to administer vaccine doses. And the question I'll give to Lynette is there any advocacy work AACP is doing with the chains to maybe ask that the articulation agreements or affiliation agreements for educational purposes be sufficient rather than they have to be employed? Could they be on a APPE or IPPE rotation with the chain? I've not heard this before, so I'm curious if you have any thoughts on that, Lynette.
No, I have not heard that as well, but it's something I certainly will take back to our advocacy government affairs folks to look at. Certainly all of our schools and colleges of pharmacy have affiliation agreements that really dictate the oversight and provide guidance for the oversight for any student that is on rotation at that site. And so to your point, Michael, there are, it would be good to be clear with that so that everyone that is able, that has been educated and trained to provide vaccinations are able to do so in the retail chain community pharmacy settings.
Yeah, I was also going to comment that one of our audience members today is a Pennsylvania pharmacist, commenting that Pitt, Duquesne, and Wilkes students are all helping independent community pharmacies with vaccination administration in PA. So I'll give you all a shout out. Congratulations on that effort. That's fantastic. Now, hopefully that will encourage more of our audience members to put their experiences in the question box so that we can give your school a shout out and your state a shout out for the good things that you're doing. I know that there's a lot going on in West Virginia. We've seen West Virginia pharmacists standing up and giving vaccines. And just a week or so ago, we had a West Virginia pharmacist that told us more about that. So that was really great. There's some comments on the pictures here. I think, George, these may be your pictures that we were talking about. Is it recommended that you need to prepare these doses in IV rooms and laminar flow hoods and eye goggles and hairnets and sterile product procedures? Is that just because you're at a university campus you're doing that, or in your pictures, or is that some special requirement? What is required for drawing up a vaccine dose?
So actually, I think that's a good work of photography. That's actually not a sterile product area. That is just in our actual vaccine clinic. It's the area we do have sequestered off in terms of just some boards put up that prevents airflow from coming in. And the individuals do in fact prepare the doses there at hand once they've been transported from our minus 89 degrees Celsius freezer and refrigerator upward for preparation. So that's done on site. And again, as you know, one of the challenges with standing up these clinics is in fact the expiration time given to these vials once they're thawed in terms of 2 hours, and then ultimately when you put in a syringe in terms of 6 hours. So there's a timing element. There's a scheduling element. This isn't something that you can just wait on and have for the next day. And so we've had situations, just to give you an example, where at one point in time there was a 17 to 21 day recommendation for the Pfizer vaccine, of which we are in terms of a window. And then there was a recommendation that tightened that to be really more on schedule to 21 days. So we ended up having 60 cancellations overnight. And so if you think about that with the Pfizer vial, where you can get up to 6 syringes out of a vial, that's 10 vials. We had to really hoof it the next day to shake the trees to remind any 1As when it's signed up to please come in and be immunized.
Yeah, great. Well, I'm going to ask Mitch Rothholz from APhA staff to join us now, because there are a lot of questions about dose preparation and pre-filling of syringes and all of that sort of thing. Let's address that. Mitch has been involved in a lot of conversations with CDC and others about efficiency with pre-filled syringes and so forth. Mitch, can you share with us your insights on this topic?
Thanks, Michael. So folks may remember in early webinars, the recommendation was not to pre-fill based upon the data we knew at that point. A publication will be coming out soon from USP, where they actually pull data from manufacturers that actually has documented that you can pre-fill syringes, but you can only have it out for 6 hours. So that's 6 hours for the Pfizer vaccine from the time you added the solution, the two solutions together, or for the Moderna preparation, that's 6 hours from the time you first penetrate the vial.
And so, Mitch, I think what USP's guidance is based on stability of the vaccine in the syringe, and that was somewhat in question. We just weren't sure about it. And so what you're telling us is USP now believes that there's enough data to have confidence that the vaccine is stable in the syringes for up to 6 hours.
Correct. You say more eloquently than I did, Michael. Thank you. It's all based on the manufacturer's data as well.
Okay, from the manufacturer's data. So that's great. So Catherine, in your picture, I saw you were pre-filling some syringes. How are you doing that? Do you have runners that come back and forth and say, hey, we need another vial prepared, get it down here quick, we got people waiting? What's the flow? What's the process? How are you getting it done?
Definitely. So we actually have access to the appointments for the day as well. So the clinic opens at 6:30 in the morning, and we're there every single day. And so we kind of get an idea of how many patients we're going to have first thing. So a lot of that bulk vaccine preparation is done in the morning. And every time we finish a vial, we put all of the prepared syringes in a bag with the vial. And then on the vial, we write the beyond use date, the time that everything was mixed, so that when the staff downstairs is administering the vaccine, they can always make sure and look and see Oh, has this been longer than 6 hours? Luckily, we haven't had any problems where anything has sat for too long because we're preparing them as the day goes. So we kind of have conversations between Dr. Ashmead and then Amy Patterson as well, and they're texting and saying, hey, we just got this added to the schedule, like make sure we keep that into account. And we're always running numbers back and forth, like what's our total for the day? How many do we have? How many have canceled? So it's really good communication efforts and great interprofessional connections.
Yeah, it requires a lot of coordination to be able to get these vaccines into people's arms and not waste doses. It's definitely a bit of a puzzle. Well, we like to engage our audience, and so we've got a couple of poll questions this week. We're going to put the first one up. We'll ask all of you please to respond. What roles are student pharmacists involved with at your site? Maybe you are a student listening in today and want to respond to what you're doing, or maybe you are reflecting on what students are doing at your site. Tell us about your practice. Don't be shy. All you got to do is click on the screen, select the answer that applies to you, and that'll give us some information about what's going on currently with our audience in practice. All right, we'll close the poll. And it looks like that vast majority of our participants today have students involved in both vaccine preparation and administration, and there are some other activities that people have their students involved in as well. Well, a second question that we have for you here is who in your practice site is allowed to supervise student pharmacists in vaccine administration? So we brought that topic up a little earlier for discussion. Are only pharmacists, are other healthcare professionals allowed to? Is it both? Are you just not sure in your state? We've raised a question that now you don't know the answer to for your state, and that's possible too. So let's get your responses on this about who can supervise a student. And very important here for us to take a look at this question as well. All right, let's close the poll. And 62% of you say that it's a pharmacist that must supervise a student pharmacist. None of your states allow other healthcare professionals to do that, at least for those listening today. Well, actually, that's not true. 20% of you say that both other healthcare professionals and pharmacists. And there are 17% of you for whom we've created doubt. Now, it's never our intention on this program to create doubt. So we do want you to follow up after this program to verify with your state who may supervise students. We can close the poll, staff, if you don't mind. So we do encourage you to take a look at that very carefully and determine what is the best practice for your particular state and how to move forward. Now, how can APhA help expedite expanding vaccine availability to community pharmacies? And Mitch, I'm going to bring you back again and on this topic. And Elisa, I'll have you come on with us as well. I'd like to ask staff members Mitch Rotholz and Elisa Bernstein, who are working very diligently with our federal agencies about the vaccine distribution efforts. And I'd like for Mitch and then Elisa to make comments on this particular thing.
Okay, thank you, Michael. And Meg, I don't know if we can go down to the slide that has the 6 paths for pharmacy, but last week we made you aware of a chart that compared the different programs that are available for pharmacy engagement. And as Michael said, Elisa and I have been spending a lot of time working with federal agencies and also our partnering pharmacy organizations and public health organizations to work through strategies of how to better engage pharmacy. Not going to happen overnight because the main limitation right now is vaccine supply, but they're starting to implement broader access for pharmacy. So you're all aware that we have the federal program for the long-term care that was limited to 2 entities and some other pharmacies that were added along for increased access. We also know that there's some states that have also engaged pharmacists to do long-term care directly as well. The other program that is just being released from the federal side is what they call the jurisdiction transfer program, where the states can use some of their allocation earlier in the process to engage pharmacy entities who have contracts with the federal government for what was known as 2B, which was later on when more vaccine supply was available. Well, they're moving that timeline up. So right now, states could use their allocation to utilize pharmacists who have signed federal contracts in the later program. So again, giving access, greater access. There are 19 entities who have contracts at the federal level, who are both national chain, regional chains, as well as independent pharmacy networks. The states also have their own mechanism to directly contract or engage community pharmacies as well, outside of having to go through the federal government. And so those are the main programs. The federal retail pharmacy program, which engages the 19 entities I talked about, that is actually going to be moved up in schedule to probably early February or earlier, where they'll activate those federal 40,000 sites to have the ability to have access to vaccine. Again, this is all dependent upon how much supply is available, but the intent is to activate the federal network as well as supplemented with the states networks, so that we got more access points for pharmacy. In addition, other access points for pharmacy include, and this is in the Biden plan that you'll hear more about a little later, is that there's the mobile delivery. So those entities that have mobile units that could go out into communities, especially communities of need, will be utilized. And there's several pharmacy entities that have those, and so those will be utilized, as well as the mass clinics that we've been talking about today can engage pharmacists, pharmacy students, and others in the process.
That's great. Elisa, we've got a slide, I think, about the Biden plan. I think this would be a good time for you to talk about that.
Yeah, perfect. And nice segue from what Mitch was sharing. Thank you. So today, the Biden administration released a roadmap, which is their new national strategy for pandemic response and preparedness. They have 7 different goals related to how to address it. And apparently at 2 o'clock today, in fact, Biden will have a press conference where he'll probably be laying this out a little bit more. And it's planned that he will be signing a number of executive orders related to the strategy. But really what the focus is to, one, make it clear that decisions are going to be driven by science and be transparent and deliberative. They're going to be increasing funding and put a focus on local vaccine programs, really to increase that trust, more funding and support for local programs as well. And although Mitch showed you the different access points, what the plan does say is that they plan to simplify and strengthen the allocation and distribution process. So we may see some more changes. We've been hearing a lot about chaos, confusion, and questions between the state and the federal communication and collaboration. So hopefully with the Biden plan will simplify that. They also talk about accelerating the pace, accelerating venues for access to vaccination, and for us as pharmacists, fairly compensating providers and providing better support to states to fund the administration, and creating new avenues for pharmacists and other providers to be reimbursed. Also within the plan is how they're going to address the supply of PPEs, vaccines, testing, and really tap into some of the Defense Production Act, which is a law that provides the ability for increased activity for supply and really fill in those gaps. So I'm gonna, there's a whole lot more. It's a really interesting document, and it's really exciting to see that they've put a lot of thought into this new strategy, and really getting the execution and implementing it is going to be interesting, and we're going to be right there from APhA to help facilitate that.
So hopefully our listeners are hearing very clearly that APhA is very, very actively involved in all of the discussions with the Biden administration and the regulatory agencies to ensure pharmacy's at the table. And in many communities, we know pharmacy's leading, and we're happy about that as well. So Lisa and Mitch, thank you for that update. Also, we'll share with everyone on a subject we were talking about earlier regarding the supervision of students and who can do that. Dean McLean, Linda Garrels McLean from Washington State University shared a note with me that Washington passed a law about a year ago that allows for interprofessional supervision, and the state of Washington, Washington Pharmacists Association has model language that may be helpful to other states. So thank you for sharing that. We appreciate it. I tell you, I said let's put out a shout out for schools and colleges of pharmacy, and I think every school on the line has started sending me comments, Lynette. I think everybody wants to hear their school's name. What do you think?
I have no doubt, and I don't like to specifically name schools because I love all of our schools equally, and they know that. But I'm glad that they are sharing what they're doing, and certainly interprofessional collaboration amongst all the health professions is something that we know each of our schools and colleges at pharmacy are doing. It's something that we at AACP are doing as well. There is a coalition named All Hands on Deck for COVID vaccination students across assisting America, and it basically provides all of the numbers of different health profession students that, and there it is, thank you very much, that are available and are working together to ensure that vaccinations and other efforts that are being done regarding COVID-19 are being met. And so we greatly appreciate everything that our student pharmacists, our faculty members, administrators, all the time and effort that's being put in here, because at the end of the day, we are here for our patients. And this really is more than all hands on deck. We just really want to be able to provide the best outcomes as possible.
Yeah. Back on the subject of pre-filling of syringes, there was a comment from one of our audience members that said, you know, actually pre-filling of the syringes to give to the vaccinators of the Pfizer product is particularly, but really with both of the mRNA products is probably helpful, because we're not supposed to shake those vials. And every time we move those vials around, there's a potential for shaking. So pre-filling syringes, putting them in a plastic bin, handing them to the vaccinator, appropriately labeled, of course, with the syringe is very important. I want to give another piece of advice for these mass vaccination clinics to as much as possible, and I'll ask George to comment on this. We're taking the approach that we're only offering one manufacturer's product in our mass immunization clinics at a time. So if, for example, our clinics open on Thursday, everybody in the clinic knows that we're only using, say, Moderna vaccine, or we're only using Pfizer vaccine that day. We're not going to have both products going, in order to reduce the risk of dosing errors, administration errors, and others. George, comment on that, your thoughts?
Yeah, in fact, and I think one of the things we also give every person who's been immunized a reminder card that basically identifies what product they had, the lot number on it, and where they received it, which is critical. We currently don't have that as an issue because we are a single source COVID vaccine, as in Pfizer. We hopefully will maintain that, but certainly as we get into other vaccines, other delivery methodologies, the adenovirus ones, as we're looking at them and they become more stable as they go out to the communities, we're going to have to be knowledgeable about that. And it's not only for us, but also the patient. We're going to have to reiterate that. What I will say, and that's why in the state of Wisconsin, we're very fortunate. We have something called the Wisconsin Immunization Registry. Many states have a similar type registry. That is the source of truth for us. That's where we will go back and try to look to what actually immunization someone has received. So we've committed in our immunization clinic that day that someone's immunized, by 5:30 p.m., we've updated their record in the WER, so people in the state of Wisconsin will know what they had. So we're a single source product right now.
Yeah, great record keeping is so important. Catherine, do you foresee student pharmacists getting involved in record keeping as a part of this and learning about record keeping? What are your thoughts on that?
Absolutely. So our school has actually, Dr. Garcia with her efforts has put together a Canvas course. At USF, we use Canvas for all of our classes and our assignments and our grades. There was a Canvas course created to train student pharmacists how to appropriately mix vaccines, preparation, how long they should sit out, and they're also going to be EPIC trained on top of that. We have our school is partnered with Tampa General Hospital. They use APhA. So APhA can actually cross over to Florida Shots. So these students are going to be trained in the data entry process to earn their IPP and APPE hours, but also understand how important it is for continuity of care for our patients and making sure that everything crosses over appropriately. So taking that off of the hands of somebody else to kind of smooth out the COVID clinic process.
Yeah, and we've gotten a question in on another topic as well, that a lot of community pharmacists across the country who have not yet gotten access to vaccine within their own pharmacies to immunize patients, they themselves are also having some difficulty getting the vaccine and getting immunized. I just want to remind our listeners that Tier 1A does include pharmacists and pharmacy staff. And one of the things that we did here, and I know we've got a lot of college and school of pharmacy people on this call, so I'll encourage my colleagues to consider doing something similar. When we opened up our community vaccination clinic to include all community-based healthcare workers that were not a part of a health system, we sent that invitation out to our preceptor listserv so that all of our preceptors and pharmacists within our networks, and we also send it to the Inland Empire Pharmacists Association, so the local pharmacy association would be aware that we had clinic spots open so that pharmacists and pharmacy staff could get vaccinated. So let me just encourage the schools and colleges to leverage your position there to help make sure that our community pharmacy workforce does get vaccinated, even in advance of them receiving the vaccine in their own practices. Now, we're getting very close to the end of our time, and I got to give some shout outs here because we got so many schools, and Catherine, they want to hear this. Lynette, they want to hear their names called. So, you know, I see Iowa is going, lots of students helping to vaccinate at University of Iowa and Drake. In Arkansas, they're helping in all venues across the board. Both schools in Arkansas have been giving vaccines in hospitals and long-term care facilities and in community pharmacies. University of California, San Diego, students have been involved with mass immunization clinics. University of Oklahoma, they're leading a vaccine effort on their health sciences campus. Notre Dame, Maryland School of Pharmacy has been involved. Belmont University School of Pharmacy is partnering with nursing students. And they're very glad that Lynette loves everybody. And Creighton is working with nursing homes. Now everybody's trying to jump in because I'm naming names. So there's just so many different schools out there. Albany College of Pharmacy and Health Sciences is doing a big COVID clinic. I could just name all of the schools of pharmacy are so involved. It really lifts my spirits to hear that we've got so much dedication to ending the pandemic. And so Lynette, Catherine, George, thank you for joining me as our guest today to talk about how schools and colleges of pharmacy are helping to bring this pandemic to an end. We appreciate you being with us. And now I'll let you folks go, and I'm going to ask Mitch Rotholtz to come in and share some data with us that is hot off the press, just collected this particular week from pharmacists across the country. Mitch, share your insights.
Okay, thank you, Michael. So we've been doing surveys, what we call touch-based surveys, pulse surveys of pharmacists to kind of see where their thinking is in regards to COVID vaccination. So we did one in September, we did one in November, we just did one, as Michael said, this past week, and today we're actually releasing the results of the third survey. So in this survey, we are seeing what we were hoping we were going to see in terms of confidence level and willingness of pharmacists to do COVID vaccination. So in this case, in looking at their own personal vaccination, 92% of the respondents to the survey have been or will get vaccinated as soon as they can. 10% indicated that they received both doses already, and 51% said they received the first dose and plan on getting the second dose on time. And then 31% said they will get vaccinated as soon as they can. And so that's a good sign in terms of the willingness of pharmacists to get vaccinated. Next slide, please. In this question, we asked, what's the comfort level of pharmacists to addressing vaccine confidence and vaccine hesitancy concerns raised by individuals that they're working with. Nice result here in terms of 95% indicated that they're comfortable having that discussion with individuals. So that's good, because that means that they're looking at the information, they're digesting it, and they're able to address concerns. Next slide, please. When we looked at what best describes their personal willingness to engage in the vaccination process, 78% said they were willing to order, prescribe, and administer a vaccine in their practice and community, which is good, because as we're getting more experience with the vaccine, I think we're seeing an increase in the numbers. You can see an increase from the last survey. We're seeing an increased level of comfort by pharmacists as they're seeing other pharmacists doing the immunizations, and they themselves are getting comfort level with it. Next slide, please. And then we asked in terms of logistics, how many people, do you have access to vaccine? 41% indicated that they currently have access to vaccine. And then if you look at 38% said they're ready or almost ready to provide vaccination as soon as they are able to get it. So they're prepared. So when you take those two numbers together, we've got 38 plus, we have 79% who are saying they either have it or are ready to do it as soon as they can get it, which is good. Next slide, please. And then in terms of support, 79% said they had adequate support. And we've heard pockets of concerns. We are continuing to advocate for making sure that practices have the necessary human resources and protection resources and others to sufficiently do vaccinations within their practice and manage the flow of patients. And we're also advocating that pharmacists are not put in the middle to have to be an enforcer to ensure that individuals meet certain tier requirements. That should be left to the public health system to indicate who should get vaccinated and not put the provider in a position of being a police officer. Next slide. I think that's the last one. Okay, Mike, I think that's the last slide.
So Elisa, now I think you've got a little, we'll skip past this slide and the next one and go, I think Lisa's got some COVID resources information to share.
Yeah, thank you. Yeah, the APhA practice team machinery has been working really quickly in providing these know the facts resources. Hope you all have gone to our webpage that has the library of all the resources, and we have a couple of new ones to share. Fresh off of the presses is one today, the minimizing COVID-19 vaccine dose variability. So many of you, those of you who are preparing the syringes know that depending on how you do it and what the size of the needle in the syringe is, you may get 5 doses, you may get 6 doses, you may get 7 doses out of a Pfizer vial. Well, the reason for that variability depends on the dead space volume, that actual amount of dead place or volume within the needle or the syringe where drug just hangs out. It doesn't mean that you're not going to be administering the correct dose. It's just when you draw it out and it's accounted for in those syringes and how it's marked on the syringes. Anyway, we prepared a document to help you identify how to get the most out of what you have, assuming you have the right low dead weight syringes. So go to this, we just posted it, and it has some really great information. We also will be very shortly, probably before the next webinar, putting out a new one on reimbursement and billing. So you should have that website for our library of resources bookmarked, because we're just constantly updating it. Mitch earlier told you a little bit about USP and the toolkit that they will be issuing. So that is also going to be linked into this new resource when it's available as well. And on the next slide, on the Pharmacist Guide to Coronavirus is all you need to know for a pharmacist about COVID. Again, hopefully you've had this bookmarked and go to it regularly, because there is a wealth of information and it is updated daily. What we found, though, is we have so much information about COVID-19 vaccines and immunizing during COVID-19 that we had to take our page and break it up to make it more usable so you can find the information more readily. So one deals with just the COVID vaccines themselves, and then the other deals with immunizing and immunization practices. I highly, highly recommend that you go to these web pages, click around, tons of great information and refresher information for you. And I think that's it, Mike.
Well, thank you, Elisa. And since we've got a lot of student pharmacists and faculty on our call today, I don't normally talk about specific products or specific things that used, but because I am myself a dean, I'm always thinking about how we can improve the quality of the service. And we realize that we're teaching students to be excellent in their vaccinating skills. I want to point out a product that we are using that we found very helpful in student training, especially in mass vaccination clinics. It's an inject safe barrier bandage, and I'm not necessarily providing an endorsement. This is not an APhA endorsement for certain, but I want to point this out because this Band-Aid fits on the top. You put it on the site where you're going to be injecting after you swab the site, and then you can inject right through the bladder of the Band-Aid, and it reduces the number of manipulations you have to do with the needle. Then you don't have to put another Band-Aid or cotton ball, and everything's sterile and it's sealed inside. We have found at our School of Pharmacy that these really help us in supervising students from nursing, pharmacy, and other places that may not have as much experience administering to make sure we get the vaccine in the center of the deltoid. One of the dangers of administration of vaccine is if it gets too high in the shoulder, we can cause shoulder injury due to vaccine administration. So I want to emphasize to all of you to do everything you can in supervising students to make sure that the students are getting the vaccine dose in the center of the deltoid muscle. That's where the vaccine belongs. Well, that was an educational moment you didn't have to pay any extra for, but if you're looking for a great educational opportunity, APhA 2021 is right around the corner. March 12th through 15th, there are dozens of CPE credits on lots of topics, including COVID and immunizations, but also on a variety of other subjects that'll be available. There will be some unique opportunities for you to connect with your colleagues across the country in real time live as a part of this meeting. We're going to make this feel like an APhA meeting, but it will be virtual, and so it's very important that you take advantage. Registration rates have been reduced and the early bird rates are available through February 28th. We'd encourage you to register. I think you'll find this is a very affordable conference to attend, especially since you won't have any travel involved with it. And we'd encourage you to go ahead and register for APhA 2021. Now, next week, there is a program that will happen at the same time in the same place. And that is our Fostering Vaccine Confidence program. I'm going to tell you that you're going to have a guest host next week, APhA President-elect Sandra Leal, who has done a lot of work on the topic of fostering vaccine confidence, will be your guest host next week for the program. And we have some exciting guests and you won't want to miss it. So please, next week, join us at the same time, at the same place, and you look at pharmacists.com in the COVID vaccine resources for today's recording to be available tomorrow. Thanks for all that you do. Happy vaccinating, and God bless.